Okay, Craig. So I know Sam is out there getting his toy with our assistant, but I wanted to talk through a little bit about what we see for his teeth, and then talk about what options he might have. So we are seeing, we kind of showed you a little bit on the radiographs. We do see those couple small cavities on the radiographs, not big. Probably not a hole in the tooth. We know, especially in kids' teeth, cavities is small. Less than 5% chance that there's a hole in that tooth. And when that happens, we can stop it. So, there could be a hole. We're not positive, but assuming there's not, we could stop it. And so I want to talk to you just kind of about the different options that you might have as you think through what works best for you and Sam.
Sure.
Cool. So the first thing that we could do would be to kind of paint this liquid on his teeth. We can usually do that in office. I know he's young, but it doesn't hurt. There's no shots or anything like that. So we put this liquid on there. We can do that, today even. We could do it in a couple weeks. But there's evidence that shows that, almost 95% of the time that's effective in stopping cavities like this in kids like Sam. So that would be one option. Second option would be, there could be a hole in the tooth. You might not feel comfortable with that risk level, 5%. I'm not comfortable with that. Maybe I do want to get fillings. With him being 3, that could be challenging, just in terms of him behaving. And so sometimes, we could have to do that in an emergency, not an emergency room, but like in a hospital, under general anesthesia, which has certainly its own risks. The last thing, we could certainly just try, we could get you some fluoride toothpaste and some other strong things like that as well that could stop the cavity as well. And that could be, either in conjunction with the first option, the liquid, which is called silver diamine fluoride. Or it could just be by itself. So, you want to just try some toothpaste. You don't want to put anything in his mouth. You don't think he's going to behave for that, whatever. So we kind of have 3 different options there. I wonder what your thoughts are, what questions you might have.
Sure. Well, I was kind of surprised to hear there were options. Actually, I was thinking he was going to be stuck getting a filling.
Okay.
So this is pretty cool. The thought of just painting liquid on his teeth here at the office is intriguing.
Okay.
Is that safe?
Yeah, certainly very safe. We've seen over and over again, this stuff is incredibly, incredibly safe. We use a very small amount. It's super safe. The one negative that we do see is that the spots where there's a cavity, it tends to turn them black. For Sam, they're between his teeth. I can't even see him now. So you likely would not be able to see that. But that is the negative, especially if it was on his front tooth or something like that, it would turn it black. But, given this, we probably won't see that. So that's really the biggest negative that we see.
Sure. And I don't see any problem with that from my perspective, and obviously Sam could care less too. I'm not real sure how his mom's going to feel about it.
Yeah.
Later on down the road, if the look of it is unacceptable, is there something we could change later on?
Yeah, totally. I mean, there's obviously options in the future, especially if he's behaving, well in the future or something like that. But again, we probably will never see it in this case. So for him, it will probably be totally fine.
Okay.
There's also, one of the benefits of that option as well is it tends to prevent cavities on other teeth. So in the future, he might be less likely to get cavities on other teeth because we had chosen that option as well. So that's another potential benefit of that as well.
That sounds like a really great option then to me. I would, if I have to choose right now, I definitely pick that choice then.
Okay, cool. Well, that sounds great. And if you need to maybe talk with your wife, it sounds like her, opinion is important here as well. So maybe talking through that with her might be valuable. So we could certainly, have you come back, next week if you decide you want to do that as well. So how does that feel?
Good. I don't see any negative to it at this point though. And the idea of having to come back again,
Okay.
if you can do this today.
Yeah.
Then I guess I would pick, let's go that route.
Okay, cool. Yeah, maybe you can even talk to your wife or something right now, give her a call or something and chat through it with her. And yeah, we're happy to do it today.
If that works minutes, I can give her a call on that, but it sounds like a great option to me.
Cool. And then the other thing, with the toothpaste there, that's something that we can do as well. We can also put fluoride varnish, which is this kind of almost like a nail polish that we paint on the teeth a couple times a year.
It's the in-office fluoride treatment that
we've done before, for him. Exactly. Yeah. So that's something that we could do as well to help prevent these problems in the future. The silver diamine fluoride helps prescription toothpaste, and it might be hard for him to spit too. So that's something to consider, but we can talk about how we could kind of maybe mitigate those effects, and then putting some fluoride on his teeth as well. So how does that stuff sound to you?
Anything we can do to prevent this from happening again, I'm definitely all for.
Yeah,
so those sounds like great options.
You don't want him to have problems moving forward, and you're willing to do what it takes to help him avoid that.
Right.
Great. Yeah. Well, we can start with that kind of liquid, the silver diamine fluoride today then. You can go chat with your wife. We'll kind of get set up assuming that you think that she'll say yes, and then we'll we'll get you some toothpaste as well and go from there. So
That sounds great. Thanks, Dr. Allen.
yeah, for sure. Thank you. We appreciate chatting with you.
Thank you.
Yeah.